So, welcome, dear friends, colleagues of the past, and newcomers. I would very much like to welcome our research affiliates for this autumn. Helge Ask, a research fellow in theology, and Clio Chrysostomidis, who is actually the lecturer for tonight. I'm going to say a few words about Clio, and then we will immediately start. So, Clio is a master student at the University of Oslo. In archaeology, having obtained also her BA at the University of Oslo. Clio focuses on bioarchaeology, ancient DNA, diet, and disease, which I find it both exciting and very timely for future research. And because of this specific topic, she has been an intern and she has attended courses at the Vienna Laboratory at the American School of Classical Studies in Athens. She has also been very active as a student, I heard, both as a student representative and the editor of the Tabula student magazine and other posts revolving around student life. And last but not least, she has been awarded the Erik Östby stipend, which is a new stipend introduced in 2024 by the Norwegian Institute upon the initiative of Dr. Paschalis Zafiriadis. And you're actually the second grantee presenting her work at the Institute. So congratulations for this achievement. Good luck for the completion of your master thesis. I heard it's coming soon. And illuminate us on practices, infant mortality and practices in ancient Classical and Hellenistic Athens. The floor is yours. Thank you.
Hi, welcome. So my name is Clio Chrysostomidis, as you have heard. It is a great honor for me to be here at the Norwegian Institute of Athens, and thanks to the archaeological stipend. This lecture is based on the studied material for my master's thesis, as well as the studied feeders, which is the reason I got my stipend here. I am still researching for my master's thesis, so I welcome feedback and comments at the end of this lecture. And yeah, so now we'll go on. Yeah. So first, we will begin the lecture by touching briefly upon infant mortality in antiquity. And then we will move on to paleodemography as a method before looking at some of the archaeological evidence. And I will bring up two cases for you, which is disease and burials. And then in the end, we will conclude with some summarizing thoughts on infant mortality in antiquity. So, according to Mark Golden, 30 to 40% of newborns in classical Athens died within their first year of life. And Angel in 1971 even suggested that 50% of infants died in the classical period and that 70% died in the Hellenistic period. In Greece, in the present day, in 2024, according to UNICEF, there were 3 deaths per every 1,000 live birth in the first year of life. This is at 0.3% in comparison. Even though it's an acknowledged fact that the infant mortality was high and remained common in many parts of the world into the modern period, it can be argued that the presented statistics are believable, but are they credible? We are, in other words, talking about quite high numbers. So, this quote by Aristotle has been quoted quite a lot in the paleodemographic surveys and the research on infant mortality. It reads, most deaths occur before the 7th day, which is why they give them their names then on the grounds that they have more confidence by then in their survival. This quote has been commonly misinterpreted by scholars as evidence for high infant mortality rate, and some have even declared a mortality rate of 25 to 30% based on this within the first year, based on this quote alone. This misinterpretation is likely caused by the translated expression that most deaths occurred within a week, but it should rather be interpreted that those who died within the first week. So the statement by Aristotle should therefore be interpreted as that the first week was the most vulnerable week of life for the newborn. And it also attests to the Dekate, one of the first rites of passage the ancient Greek would experience, celebrating their welcoming into the family, usually occurring inside the family household 10 days after birth. Dekate, 10. So, prior to the Dekate, the child was actually considered a brephos from the time it was still in the womb as an unborn child to the days immediately after birth. And the infant was, despite these developmental stages that happens during these periods, considered to be asleep for the first 40 days of life in a state of unawareness. So it was basically lying there, right? And this also attests that the first 40 days of life was also a very vulnerable period for the infant. So much of the statistical numbers, whether they are educated estimates by scholars or based in palindemographic methodology, should be questioned for biases or insufficient data input. The studies that have been performed on the palindemographics of ancient Greece have often been based on a limited and a restricted material, which I will discuss soon. And it is therefore important to examine just how credible these statistics are. We therefore have to go back to the basics and ask ourselves, how can the archaeological material give insight into the infant mortality and the child-rearing practices of classical and Hellenistic Athens, which is the topic for today. So now we will go into the topic that is palindemography. So while palindemography may provide context on the organization of family, firstly I should say that by studying paleo populations through palindemography, we can gain an understanding of their structure of deaths, which is the distribution of deaths according to age. And by studying this, we can also gain a greater understanding of their organization of family, their care and labor, and also the subjects such as diet and disease. And despite the facts of studying palindemography, the research method, it also bears risk of errors and bias in data and results. And in contrast to historical demography, it is based on, skeletal populations mostly. Palindemography has been based on skeletal populations from one burial ground or multiple. In many cases, this means that you have a 5,000-year span and you do a survey on 500 studied individuals. Yeah. And then the archaeometrical studies such as radiocarbon dates have also been proved very good, which I will come to later, but the historical demography are based on literary records providing more details, such as registered lists of soldiers, population records, marriages, etc. And these historical records give us more details, like age, height, where they were from, and their sex. Palindemography, because it's studied on skeletal population, it gives more room for error. The sexing of the skeleton is usually very secure, but the aging can provide some difficulties. Often cases, it's difficult to age people above 50 years of age. So in some cases, people who are over 50 years of age may become a part of the same category, 50 plus, as the 90-year-olds, but it's quite a, difference between a 50-year-old and a 90-year-old, right? So this creates quite a large gray area. And how are these calculations made? Weiss argues that in order to utilize these skeletal populations, one must assume that stable population conditions were present at the time of the deposition of the skeletons, and one must also assume that the sample is representative of the population and that it is free from systematic aging error, like I just said. Quite a lot of assumptions. And this is the standard formula for calculating the mortality rate. Now, this has been produced, developed, redeveloped, and gotten some critique and support. Yeah, but this is the gist of it. It compares the probability of dying and the probability of surviving. And then, LX, as you see here, it stands for the age cohort. So this means that in a demography that you would perform today, you would usually take, let's say for the year I was born, the year 2000, 100,000 people from the year 2000. And then you would see as they proceed, when they reach the age of 15, for example, how many have passed away then? And then of the same group, how many have passed away at the age of 35, for example. So this is an age cohort. But it is very complicated, so I will not touch more upon this, so you get the idea, hopefully. But thinking back on these assumptions, we have to be aware of the cultural context and the importance of it. The scientific methods and big data processing of larger data sets, as well as the continued development of innovative and international databases, have provided us with more material than ever to not only make such analysis, but uncovering more of the potential cultural context, such as diet, mobility, and climate. And feeding these data sets into SPDs may very well provide interesting and eye-opening results, free from systematic error. But this is one, it's important to remember the cultural context. And this study is one of the more interesting ones I've found. It's test by Edinburgh et al., or study by Edinburgh et al. From 2017, where they studied the bubonic plague and the population decrease during this period. And they interestingly used the oral historical records of the Tsimshian First Nation communities in Canada to compare to their results from these radiocarbon dates. And amazingly, they correlated. So this means that they conclude their study by arguing that we should actually trust oral historical records from Native communities in greater scale than we have done previously. So, assumptions, while making these assumptions, as we saw in Weiss's calculation on the previous slide, can be very fundamental to even make such calculations and get those percentages and numbers out from the mathematical studies and present them to our research. Making assumptions may actually give into confirmation biases, and they may spread misconceptions to our audiences, the public. So, what are the paleodemographic gray areas of classical and Hellenistic Athens? As Aprig 2019 argues in Population and Economy in Classical Athens, these early methods for estimating demography were inherently male-centered and did not account for populations or social groups, that would not be visible in either burial grounds, archaeological material, or literary evidence. Most of these calculations have actually been very interesting. They have been based on pottery sherds. They have been based on areas, how many people can live in this certain area based on the square meters. But more commonly, they have been made up of lists of soldiers, right? So social groups who could not participate in the Athenian democracy and who would not be written down as soldiers were still present and active parts of the Athenian society, and they are therefore important to its demography. So we have women, enslaved people, non-citizens, and infants and children. So immigrants that were both free and enslaved were a major part of the population of Athens. And during times of war, they were actually needed as compensation for death rates before eventually marrying and living in Athens for certain years. They became citizens, free citizens. And migrants should actually be categorized as people with short stays in Athens, such as traveling doctors, ambassadors, or mercenaries. And women are mostly documented from cemeteries or marriage records. And then we have a few burials from enslaved people. We usually find them in literary records. And non-citizens are, as you can understand, difficult to travel. But for our topic today, infants and children are mostly from burials, which are very few, and they become even more scarce towards the Hellenistic period and throughout it. Now, for a very interesting part of it are those who were died without burial rites. So Lindenlauf argues that this type of disposal of the body without burial types was called apathon riptain. I probably pronounced that very wrong. But these bodies were thrown into pits, natural fissures, bodies of water beyond the borders or within the borders of the community or the state, city-state, the polis, thus leading their corpses to be gradually decomposed at the hands of nature and scavenging animals. This means that these people will completely have disappeared from the archaeological record and may very well have been, non-existent in the historical records. So to summarize, these social groups described above account for quite a large gray area in the proposed numbers and statistics of the paleodemography. We should therefore be very careful on making assumptions to trust the proposed numbers and statistics of the paleodemography of the Classical and Hellenistic Athens period in Athens. So while paleodemography as a method may be very useful and an interesting methodology to understand archaeological societies, it should be used with care and an awareness of biases. In regards to the infant mortality of ancient Greece in general, there is not enough evidence, archaeological material, and there is also an essential cultural context to be considered. I will not make use of paleodemography in my thesis. I will rather use the strength of humanities to understand the infant mortality. So this means that certain subjects such as birth and death can be seen through the concept of the human experience, which is the idea that the human condition is a shared condition, and the responses we have to different situations therefore can, to a certain extent, be understood through generalizing models that allow us to relate to other human beings across cultural and chronological barriers. And as Liv Nilsson Stutz argues for this, one of the greatest examples of this is death. Death, as she argues, is a crisis. It has to be dealt with. You're left with the corpse of a beloved one that becomes, a stranger. It becomes an object, and it has to be buried due to hygienic reasons. And we can relate to this across chronological and cultural boundaries. This concept is also known as common sense naturalism. So we can therefore understand them as part of our biology. And it is also common to argue that emotions are not compatible with science. However, Sarah Tarlow has contributed greatly to this through her work on emotions in archaeology. And I very much agree with her that exploring emotions help us gain a greater understanding of the archaeological material, because it expands our understanding of the material and context we find it in. In example, a child buried with toys and their belongings indicates that the people who buried them cared for them and that they wanted to extend this care well into their afterlife. So how can we study the infant mortality and the child-rearing practices in classical and Hellenistic Greece? Let's move on to some case studies. First of all, the burials. From the 8th century until the 5th century BCE in Athens, child burials appeared in high frequency before they became more rare, declining steadily throughout the 4th century and the Hellenistic period, when they were especially rare in the 2nd and 1st century. It is possible to distinguish 3 age groups from the burials we know. These are the infants, the small children, and the older children. And we know we have categorized these age groups based on the skeletal developments, but we can also use grave goods to help us categorize them better. Because as we see, feeders are actually more present in burials of the youngest children, the infants and the small children. And then we see that lekithoi are present as the child gets older and as they age as a human being. So feeders are, as you probably understand from the word, associated with feeding the infant, while lekithoi is associated with purifying the dead body. So as you see, it's a change in their perception of the child as well. So why are there so few burials of infants? And where are the children? There are 2 reasons for this, as I see it. Erosion is a major part of it, because infants have a very small size, and they're especially susceptible to natural erosion and damage due to their fragility and their high porosity and low mineralization. As you can visualize, an infant is in high development. Their bones are filled with blood, and they have a lot of unfused parts in their bodies. For example, the collarbone will have an unfused part at the end of it, which will look like a small pebble. So to an untrained eye, these body parts and skeletal parts may very well just disappear during the excavations. So just to get you a perspective of how small infant remains can be, this is a reconstruction of an infant skeleton. It's not from the Classical and Hellenistic period. I think it's from the 17th century, if I remember correctly, but you can see just how small these bones can be. And as I've heard through the courses I've taken at the Weiner laboratory, they may sometimes actually be confused for animal bones, such as chicken, which causes a great confusion to why are the chicken buried with grave goods, right? And another fault that's reflecting on the erosion is that infants were often buried in urban landscapes, situated at key places in the daily traffic to and from Athens. And mass burials are also common. Yeah. And it has also been argued that if the child was a victim of infanticide, it would have been thrown into a pit or exposed in a barren landscape. So as you can understand, many may just have disappeared completely from the archaeological record. They may not be any evidence that they even existed, which obviously creates a huge gray area in the statistics as well. So where do we actually find them? One of the most famous cases that is very interesting is the bone well at the Athenian Agora, and it has been re-examined in 2018 by Liston et al. It's located at the Athenian Agora, as I mentioned, and it was the material that is interesting for us was deposited from 165 BC to 150. So it's a 15-year period. Just keep that in mind when looking at the material, 15 years. It's well preserved due to the deposited bronze, because bronze is made up of copper, and copper is what's it called? And yeah, antibacterial. Has antibacterial properties. So here you see a map of the bone well. I hope this points. Yeah. So here is the bone well, and then you can see that it's actually placed right in the center of many sacred buildings. So its location is in close proximity to the Hephaistos, the arsenal, the Stoa of Zeus, and the royal Stoa, being closest to the sanctuary of Demos and Graces. And it's also close to the boundary marking of the Keramikos and the sacred road, which can be seen in relation to the interpretation of it, as I will come to now, as an unofficial burial ground. And as Hube Nilsen states, since women played an important role in burying close kin, infants, and small children, it is significant that Athenian women were well acquainted with the sacred road through their participation in these religious activities. So let's look at the material now. This is the bone well, and inside we found over 150 infants. This means that these are the individuals that they could actually estimate that were a single individual. There may be more. They also found 150 dogs with butcher marks. It is believed that these dogs were actually wild dogs who were slaughtered before being placed inside the well. And this is weird, but they found a herb that had been interpreted as the goddess Ilithia. Ilithia is a deity, as a deity is a bit obscure. But we do know that she was actually considered the goddess of midwives. And she is in association to Artemis, Lokia, and Hera, associated as goddesses with motherhood, pregnancy, fertility, and midwives. And in the Ilithia cult, we know that it was common to sacrifice dogs. Some of you may probably know that in the Asclepius cult, it was also common to sacrifice dogs, as dogs were seen as they could absorb disease. So if you held the dog close to you, it would absorb the disease from you, and once you slaughtered it, the disease would be disappeared, gone. So we also found household ceramics and food waste, 390 non-canine animal bones, so 390 non-dog bones. And these bones, some of them had actually been butchered to be fitted into a pot, a cooking pot, which causes me and Listendal to believe that it may have been in connection to ritualistic feasts along the burial ground. But of course, the soil is gone, so we can't really know for sure. and the waste from metal production. I will also mention that some of the bones were actually considered were a toad and a raven, and these are actually considered to be ritualistic activities. So the well. First, it was interpreted to be the aftermath of the Sulla's siege, and that it's the terror of the, the murdered babies that were placed inside the well after everything settled down. But Lispendal argued that this is actually a burial site, and they have very strong arguments to support it. We have also found a similar site in Eretria, which is the Swiss school at Athens is currently excavating it. They have published some. I haven't read enough that I am able to present it to you today, but I will write about it in my master thesis. And it's very exciting because it shows great similarity to the bone well. So the manner of how children were buried changed over the centuries. Some similarities were kept and adapted, but it was common to bury infants and small children in household terracotta basins, such as bowls, like lekynae, craters, and mortars. These household ceramics are present in the bone well, and these vessels are also large enough to contain a small infants. So they have been, in some interpretations, associated with carrying the child to its final place of rest, its final destination, and that they would place the child inside the basin with a piece of cloth over it and carry it to the public site, the well. But it has also been associated with washing the child after the birth. In any way, it was actually regarded to the care of the infant. It was one of the infant's belongings. And we also see that the common grave goods for children in Attica usually consisted of, I will not pronounce these words, but you can see it. And then during the Hellenistic period in Attica, some of the grave goods changed into ungentaria, alabastra, lekynides, and the pyxides continued throughout these periods. And now for my favorite type of vessel, the feeders, which is the reason I'm here in Athens. So the thylastron and the guttus are two of the more common types of feeders. You can see them here, the guttus and the thylastron. They are rather rare. As you can see, the guttus is probably one of the more famous types of feeder, but it's also associated with other types of household activities. These vessels have been constructed to pour liquid in small quantities and very controlled. So the guttus has been associated with pouring oil for cooking, pouring perfumated oil, and also refilling oil lamps. So for if they're found in an unconvincing context, they may not be interpreted as feeders and therefore be misclassified. Well, there are quite a few of them, but there have been some studies. One of them have been performed a lipid analysis, which means that you scrape the inside of it and analyze the insides of the ceramics. And it caused a result of acids that are only associated with animal and human milk. So we do know that some of them were actually filled with milk. Sneed in 2021 has actually argued that these were used to feed infants with a birth defect that is called cleft lip, which causes the child to have a split lip here, and it can't suckle when it's breastfeeding because it can't create the vacuum in its mouth. And it's a very common birth defect. 1 in 700 infants today are born with cleft lip or cleft palate, so it's very common. And Sneed argues in her 2021 article on people in antiquity that had disabilities, that she uses this figurine, and she argues that this child is actually a child with cleft lip because the mouth has been exaggerated. So it's a large mouth, and this is her argument for it being cleft lip. So you can interpret that as you wish, but you can still see that it's a woman holding a child and a thylastron. Yeah. So this is also a modern feeder for infants that are born with cleft lip. And the device is kind of similar to the feeders that you see up there. It's concentrated so that you can actually pour liquid with a bit of force, gently of course, into the child's mouth. So it's the same concept. That's an elongated nipple as you see here. And you see also the elongated nipple here. Now, thanks to the SB archaeological stipend, I have been able to study some feeders on my own. And I'm only here for 2 weeks now, so I still have some other feeders to study. But these are my results so far. I can't put the actual pictures here because I'm not sure if I'm allowed. But this is a drawing by me. So what you can see is first of all, I've studied the AP 2541 and the M3405 from the Acropolis Museum. So thank you to the Acropolis Museum for allowing me to study them. They are both dated very, it's not from the same period of time. It's from 1000 BCE, both of them. However, they have quite a similar shape, as you can see. And most interestingly, I found that they actually have teeth marks, or what I interpret to be teeth marks. And mostly it's in scraping patterns here. So here on the M3405, it was most evident. And you could see that it had actually been scraping back and forth on the nipple, on just the upper and lower side of the nipple, not on the sides. And this caused me to believe that it's actually the 2 incision teeth on the baby's mouth. So it's the 2 front teeth. And according to Ubelaker's bioarchaeological aging method, this gives us an approximation of a child aged 6 months to a year. But what you should know about this theory of mine is that if the child had cleft lip, in over 70% of cases, this would affect the incision teeth. So this means that the feeders were probably not only used by children with cleft lip, but for many children, maybe it was to relieve the mother from breastfeeding, maybe it was to help the child, maybe children, with other disabilities that were unable to nurse. Either way, it's very interesting for me. And you can also see that the elongated nipple is present here on that vessel. So let's circle back to the milk now. The ancient literary sources describe that the ancient Greeks used dairy as a common medical remedy and breast replacement. And it was most common to use sheep or goat milk in ancient Greece. And the Greeks were actually aware of the dangers of consuming unpasteurized dairy products. I've read one article about that dreaming of cakes with cheese was a bad omen. But I haven't read enough, so I can't really present that as a plausible argument, but it's interesting to keep in mind. And brucellosis is actually still today a very dangerous disease that affects many people, mainly in the Mediterranean and in Asia and the Middle East. Brucellosis stems from a bacteria. What I should argue is that brucellosis is the bacteria, and it can cause neurological damage and skeletal impacts. It can fuse the lumbar vertebra together. This mostly occurs in men, but for women, it affects your reproductive system and causes neurological damage if left untreated. What you've also seen is that meningitis was actually very common. You saw in some studies from Herculanum, they've actually found skeletons with signs of brucellosis, and they were able to localize a soft cheese. And they studied it and found bacterial remains that are very similar to the brucellosis bacteria, which leads us and the researcher to believe that there was actually an epidemic of brucellosis in Herculaneum at the time of the volcanic eruption. This attests brucellosis to the time approximation and the area of Classical and Hellenistic Athens as well. Yeah. So it happens through ingestion of dairy products. And as you can see, it was quite common to use breast milk as a medical remedy. So what you would use is to fill them here and then in turn feed it to your child. And as Horanus from the 1st and 2nd century AD describes, if, however, a woman well able to provide milk is not at hand, during the first 3 days, one must use honey alone. Honey is very bad for infants, or mix it with goat's milk. For babies, nothing is more beneficial than butter. either by itself or with honey, especially when they're troubled with teething, sore gums, or ulcerated mouths. Rubbing the gums with goat's milk or hairspray makes easy cutting of the teeth. So we know that brucellose is a very old disease. It's been earliest found in an Australopithecus hominid. And we do know that it can actually affect, or the way it infects is either through droplet contact, skin contact, or by ingestion, right? So this means that if you're aiding an animal, for example, a goat or a sheep with birthing, and that goat has brucellosis, you will get brucellosis as well. And if you then get, back to your family and you then nurse your child, that child would actually get brucellosis. And in Mexico in the 1980s, they did a study on a mother who would consume vast amounts of soft cheese that was unpasteurized, and she got brucellosis. And she continued to eat this cheese, and it caused her child to be born with neurological damage so severe that it had lifelong consequences. And I will also say, just because it's in my feministic interest, that this is a disease that is only studied for economical reasons. It's not studied in the way it impacts women or infants. So, the feeders. Can they have contributed to the infant mortality rate? There are quite a few of them, but it's too few to make a typology and to conduct any sort of vast studies, at least yet and now. But they can have impacted those already at risk, such as the deceased or impaired. But most important to me in this thesis is that they were actually attestations for that the children who were deceased or disabled were cared for. They wanted them to live. They wanted them to live as long as they could. So on that note, let's move on to infanticide, because infanticide is one of the main reasons for the suggested high infant mortality rate in the ancient world. It's most famously known from Sparta, but I will not talk about that here. But it has also been argued to be evident in the bone well. But as we saw now in my previous slides, that this is not the case, most likely. The bone well was not a place of infanticide, it was rather a burial site. So we therefore have to ask ourselves, why would one commit infanticide? Because it's too little evidence for it, right? So in a study by Smithy from 2018, she studied why mothers specifically, and only mothers, would commit infanticide and what the predispositional factors for it were. And while this study was only conducted on mothers, I will argue that it can attest to fathers and other caregivers as well. The first one is economic stress and a lack of economic resources, such as lack of food, clothing, shelter, and medical aid. And also social isolation and lack of family support, such as a lack of multiple care, which I will come back to soon. Violence from a partner or family member is also a predispositional factor, and of course, unplanned pregnancies resulting in unwanted babies. So it should be emphasized that although infanticide is the same as homicide, it should not immediately be understood as a result of abuse or a lack of care. Though the very action of infanticide itself is violent, it does not presuppose that the motive behind the act was a culmination of a period of violence, or that the infanticide was driven by a lack of care. It should rather be considered in light of outside forces, such as the ones we saw on the last page, and cultural taboos and endangerment of the mother and the family. Patterson all highlights that there is a difference between a child that has been included and recognized properly by the family after the decata and the unborn or newborn child. And this separation of child and the fetus becomes important in the question of infanticide as a murderous action and the exposure of the child, because this does not equal child murder in either language or practice, as Patterson argues, as the death itself is not a direct result of the action, but rather an unseen and expected result of it. So it means you place the child, but you don't know what happened to it, it's very likely that it died, but it might have been picked up by someone else, right? And we see this in, biblical stories such as Moses and Rumus and Remlus, right? So, as many societies with high infant mortality rates practice multiple care to relieve the predispositional factors, as have been described before. The concept of multiple care implies that several adult figures participate in the care of the children, such as grandparents, nurses, wet nurses, and tutors, in addition to the parents. As Sommer and Sommer argues, Athenians practiced multiple care during the Classical and Hellenistic period. This may suggest that their child-rearing practices had been developed as a way to reduce the risk of infanticide and possibly also orphancy. Primarily, this is due to the care of the child being distributed across multiple caregivers, providing families support and network, and also giving them more economic resources. It takes a village. So, what about the unwanted babies from the unplanned pregnancies? We know that sexual activity outside of marriage existed. We know there were brothels, and we also know that there were voluntarily and involuntarily sexual acts, such as people in love, mistresses, rape victims, and so on. You can imagine. John Riddle has argued that the ancient societies, including the ancient Greek, did use medical remedies as contraceptives and to incite abortions. And the suggestion that the ancient societies were aware of contraceptives and abortion methods, and that they were safe, effective, and commonly used, has been met with skepticism by some and encouragement by others. Regardless, abortion and contraceptives has been a topic of discussion from the classical period and throughout the Hellenistic period in the medical literature we do know. So I would argue that where there is a concept of smoke, there must be some kind of fire. And there has been few, possibly too few studies on the ancient use of contraceptives. But what Riddle has shown through his work is, however, that the concepts of these medical treatments existed. So Hippocrates, I won't spoil it. Hippocrates did not encourage abortion or contraceptives, but still, he certainly gives a very long list on how to enforce menstruation and expel the placenta. So I will now read you some of the remedies that I have read. Potions that expel the placenta. Silphium juice to the amount of a bean. Give to drink in wine. Another means to expel. Take hold of the woman under her axilla and shake her violently. A cleaning agent. If a woman is not cleaned after she has given birth, give her clover in white wine to drink. A suppository of the same also causes the menses to break out and expels a fetus. A medication to cause expulsion from the uterus. A draught of juice from the squirting cucumber daubed on a barley skull. Apply after having the patient fast for 2 days. You would never find anything better than this. A contraceptive. If a woman must not become pregnant, give her Messi to the amount of a bean dissolved in water to drink, and they say she will not become pregnant for a year. And what Riddle argues is that Messi is a copper ore, and by consuming this in water, you would actually give yourself copper poisoning, and this would also affect your uterus, right? In a similar manner that the copper IUD is used by many women today. And how well this works, we can't really know. But it's still very interesting, and it's important to understand that they had these methods. And it's also important to note that even though these dangers may have been very dangerous, women often perform abortions by themselves as a desperate mean. So they don't necessarily care about health risks or the risk of fatality, right? But it's also important to know that Hippocrates actually aided women with unwanted pregnancies despite not encouraging abortions. I will now read your passage. A female relative of mine once owned a very valuable singing girl who had relations with men, but who was not to become pregnant lest she lose her value. The singing girl had heard what women say to one another, that when a woman is about to conceive, the seed does not run out of her, but remains inside. She understood what she heard and always paid attention. And when she once noticed that the seed did not run out of her, she told her mistress, and the case came to me. And as you can see, Hippocrates succeeds in aiding her with abortion, to the girl's amazement. But what is very important in this passage is that women were aware of the signs of pregnancies and watched them very carefully. And they also talked to each other. They knew when they were pregnant, they knew what to do when they were pregnant, and they knew where to get help from friends or people with medical knowledge when they were in need of help. And it also gives insight into that women did actually have sexual relations outside of the marriage. So, it's not just Messi, it's also many medical herbs that have been described by both Hippocrates and Soranus. And these are the same herbs that go throughout the Classical and Hellenistic period into the 1st and 2nd century AD. And anthropological studies have actually documented the continued use of herbs in folk medicine. So while the list of medical herbs is quite extensive, and some are more convincing than others, the pennyroyal is very interesting. It has actually been studied in rats by El-Ghazar and Salah, and it's been proved to be an abortion method. And it's also described by Riddle in his book, and in this passage from Aristophanes' piece. And I've highlighted what is necessary for you to read here, which is, "Dear girl, come here and let me kiss you. Lord Hermes, after such a long abstinence, do you think it would do me any harm to tuck into this cornucopia? Not if you washed it down with pennyroyal." And what Riddle argues here is that the woman and the man should drink pennyroyal before intercourse to ensure that there will be no baby. And interestingly enough, pennyroyal has actually been documented by Sullivan in the 1970s in a medical study by 2 women. Or he documented that 2 young women in the United States of America approached a hospital, and they were aged between 18 and 25 years of age. And they had both consumed extensive amounts of pennyroyal tea and pennyroyal oil in order to enforce abortion. One exited the hospital and had not terminated her pregnancy, but the other died 5 days after and terminated her pregnancy due to liver failure. So this shows that these methods are actually still common in many European villages and also internationally in other countries. And thankfully, more research is actually on the way on this topic. Mary E. Thistle has published a book this March that is called Abortion: A History. So more is on the way. But let's look at the predispositional causes again. We can assume that the classical Athenians practiced multiple care, which would greatly decrease the risk of infanticide. And if they did have concepts of contraceptives and abortion, we know that unplanned pregnancies would possibly not be a problem. So this leaves us with 2 reasons: violence in close relations and economic stress and lack of economic resources. These are hard to find evidence for. However, it leaves us with an idea of the circumstances that would cause a classical and Hellenistic Athenian caregiver to commit infanticide, which was likely households experiencing poverty. So, Acrig 2019 has argued that due to the indications that the population in classical Athens was growing both before and after the Peloponnesian War, and continued to grow population-wise and economically into the 4th century, infanticide had to be rare. And he does argue that most of the evidence we see actually is from the Hellenistic period. So infanticide may have been an increasing phenomenon in the Hellenistic period. But as we have seen, a lot of the archaeological evidence may be misinterpreted. And that if they were actually victims of infanticide, there may not actually be any archaeological evidence for it. So as is often in archaeology, we can't know for sure. So, in order to summarize this lecture, many infants in classical and Hellenistic Athens likely died due to disease and infections from their surrounding environment. The occurrence of brucellosis may very well suggest that dairy and dairy products like soft cheese was part of the diet of mothers and wet nurses, and possibly also for children in need of breast milk replacement. I would very much like to further explore why animals get brucellosis and what this may give insight to. How did they keep their animals? How do animals get brucellosis, right? Did they keep the animals together, or were the animals roaming freely? Where did they buy their milk? Was there an ongoing epidemic of brucellosis in Athens at the time? And it's also important to note that Athenian infants were unlikely to die from infanticide. Once brought into the family, they were part of a greater household with many caretakers. And if families had the support system available and a steady economy, the child would be brought up with multiple caretakers. Families without the support system would possibly be more likely to commit infanticide. But as we have seen, this would likely not leave us any archaeological evidence. So it may be interesting to look into trial cases and records from this and see how the occurrence of infanticide was and how they interpreted it. But finally, it's important to note that the archaeological evidence suggests that Athenian infants were cared for until their death. Children in need of aid during nursing from birth defects or disease were buried with their feeders. And infants did receive burials, and there seems to be a common theme in their burial styles, which we see in the Hellenistic period and continuing for some centuries later. This is a burial style that occurs in wells, and they were placed in ceramic household ware and then thrown into the wells. And we see a continuation of this in the Mediterranean in later centuries from places such as Ashkelon in Palestine, where they actually found a lot of infants buried in the sewer system. And it has been argued for many, many years that they were victims of infanticide, but the evidence may contradict this, and it may just be an alternative type of burial. And to conclude, studying archaeology requires a need for logic to make our suggestions with care, as we are often impacted by our own biases. Even so, I will argue that emotions are very important when studying archaeology. We have to understand the material with different eyes. This does not mean that we should put our emotions as the norm, but rather than witnessing the bone well as a cold-hearted and brutal bird-like trash burial, which could only be the result of infanticide, we should rather see that the infants were the care the infants had, which is witnessed in the details, in the ceramics that were part of their care and burial, and the lost details from their caregivers who wanted to signify their children's last journey. Thank you.
Thank you. Challenging, both from the methodological aspect. I mean, good luck with this combination that you're trying to use of different methodological threads and sort of schools. I mean, emotions have been a very solid methodological path since 2000 and something that has started developing, combined with all the kind of hard data studies that you are combining. So this is one thing, and the other eternal problem is, for example, infanticide. We had a lot of examples in Greece lately. Probably mothers drawn forth for
really?
babies. Yes, a couple of very, very kind of outstanding cases concerning the issue, and all the social factors that we mentioned have been definitely into the discussion. So these are kind of diachronic studies, but of course the focus is and you are that we have no more than literary sources, and of course the DNA, the ancient DNA, and all that. So it's a really challenging a topic you decided to delve into. So questions and comments and feedback.
And feedback is welcome. Also from Zoom.
Yeah, this burials in the wells is super interesting. It's also particularly if you can if you have the same in the wet or as well. Do you have any ideas about what could be the motivation for putting them in the well? Is it something to do with the underground rivers being a pathway to the babies? Or
That may very well be one of the reasons.
and also they were buried in the burial ground as well, or were they not buried in the normal?
We rarely find them in the burial grounds. We do find them near domestic houses sometimes, but there are so few burials. So there are, of course, a few burials from the public burial grounds, but we find most of them in these mass burials. And the bone well was very lucky because they were actually preserved due to the copper, right? So who knows how many others are just lost to the archaeological record. But I think it's very interesting what you're saying with the rivers. And I think that's a very clear reason for it. Wells have been associated as ritualistic places, and they are usually repurposed. They are first used as water sources, and then often they are repurposed either as ritualistic grounds or as just trash dumps. But how many of these trash dumps may possibly be ritualistic sites, right? Depends on how we interpret the material. So I really do think that the wells are just an alternative type of burial because of this, association with water, and that this was the place they could actually bury them. Because if you can't afford it, if you're not allowed to bury them, but you still want to have them as part of your everyday life, and you want to have, go around and know that your child is there. This is why Demakis has argued that they were actually placed in the wells because they are key spots locally, and that they would pass them and keep them close as a continued and sort of lived part of the community, in addition to the ritualistic aspect of it. Did I answer your question? Yeah. There was water there. I can try to go back. Yeah. Wait. Let's go back to the slide with the well. Did it work on Zoom? Okay. So you can see here that there is a water level. It's an estimated water level, and they had to bury, but obviously this has, disappeared with the years as well. But they had Dorothy Thompson, I think her name was, who conducted the excavation in the 1937. She writes that they were digging through bones for days until they finally reached water. So there was water still present in the well, but it cannot have been used as a water source. Yeah. Yeah.
They were covered.
I have to recheck the article, but I would imagine that there wasn't actually so much water left because it had been used as a waste dump for some years before being repurposed as a burial site. Because it was used actively as a water source during the 4th century, and then after that it was abandoned, right? So for some centuries it was, closed off, abandoned, and then they would throw trash, and then during those 15-year period between 165 to 150, they were throwing the babies. So I don't think it would be so much water, Yeah, so it's kind of more brutalistic as I imagine it. But of course, I would have to recheck the article.
There is a question in Zoom. Thank you. Right, actually. Thank you for a fascinating presentation. So the archaeological record does not provide sufficient evidence to support high mortality rates. I think that's through aging, during birth defects, illnesses, etc. And so there are no certain facts Our present-day hypotheses are mostly projections from our experience to the past. Is that right? You
Wait for me to I had to understand the question. So you're asking if that because one more time, please.
Yeah. So the archaeological record does not provide sufficient evidence to support high mortality rates, high stillbirths, poor hygiene during birth, birth defects, illnesses, etc., and also infanticide. Our present-day hypotheses are mostly projections from our experiences to the past. Is that right? Basically, yes.
No, I wouldn't necessarily argue that it's based on our experiences. Yeah, you can't really use anthropological studies and we can't really use anthropological studies from present day to understand and apply directly to the classical and Hellenistic period. You only have to take into consideration the archaeological material. If not, you would give into the confirmation biases, right? But then you can, again, as I like to do in my research, use anthropological evidence and studies to understand the material better. So if you do have the material, you can apply it to anthropological studies to see if there's any correlation and if it gives you any enlightening on how the material is made together. But there is very few records. We do have medical cases from stillbirths and so on, but there's no records. So what we do know is just from the medical records and the few skeletons we do find. Did that answer the question? I hope so. Okay, thanks, Ellen.
Yes, thanks.
Okay, good. But we should be very careful with applying anthropological studies because it may also be problematic for the modern populations that are studied in present day. We do not want to compare modern civilizations and populations to antiquity, right? Because it creates division and causes racism and everything. So we have to be very considerate when applying anthropological data. I would say.
When I saw the cover, in fact, I was thinking about the apotropaic studies in connection with mother myth.
Yeah.
Not have tried from the heavy life, for example, they were like speaking. The mothers.
Oh yeah.
Were speaking. Yeah, something like that is also in Theocritus and some mentions for literature.
Oh, that's interesting.
Yes. But I have a question. Have you found some details or parallelism in your figure pottery? Because you use a lot, so I was interested.
Yeah. So
even if, for example, also about the size, because in figure pottery sometimes children are figured like mini adults. So the size is not very in proportion with reality, so it's not a realistic depiction.
Yeah, me and Helge actually discussed this a bit earlier for the ceramic motif on the cover, that the baby's quite large, right? It looks like a 3-year-old. And we do not know how long they were breastfeeding for. In some studies I have read, they approximately stopped at 1.5 years of age. And that does not look like a 1.5 age infant. So yeah, it does apply to that. But I think what could be interesting would be to conduct some sort of research on the teeth of infants, just to see if, and do isotopic study, to see if they had been introduced to new food, or if the food was actually the same as the mother, which would be impressive. I think that could be the most efficient method to do this, but this is a dream case scenario for me, right?
But because it's symbolic representation.
Yeah, it's symbolic. And no, I'm actually looking for more figurines representations. Because I'm mostly bioarchaeological in my studies. I do only use the figurines for, this is a woman holding a philastron. This means that philastron were there. But I think the deeper motives behind the figurines and the motives are very interesting to me, and I would love to learn more about it. But I'm not sure if I'm able to do so from my point of study, and at least now. And I would love to take it into consideration.
Questions?
So first of all, thank you, Theo, for this lecture. It is very intriguing and very interesting. It's material. It's not only anatomy, so it's great to learn about this stuff. And I have a suggestion, but it's from the perspective of a biblical scholar, which is sort of the outskirts of archaeology, and usually biblical scholars tend to work with text and not archaeological material. But you mentioned the infanticide of the time of, or in the story of Moses, from the book of Genesis. Of course, the book of Genesis was translated to Greek during the Hellenistic period. It's a Septuagint translation, and in the aftermath of that, there have been several writers from the Hellenistic period that commented on this text. Of course, we're now into the Alexandrian, Egyptian, to be that area, not the Athens of the Hellenistic world. But and it's a long shot, but perhaps there could be something there that might refer to that side in the Hellenistic area, and if you're lucky, that's even the Athens or the area. So it's a long shot, but it just occurred to me.
Yeah.
Perhaps there could be some extra material to work with that.
I'll definitely look into that. Yeah.
For example, 5 out of 10 already. Of course, the rate, but still.
Thank you. Yeah.
Dear Christine Dresden, as very interesting take on the contaminated baby figure. It reminds me of the so-called murder bodies from Victorian era England, where hundreds of babies died due to diseases contracted from the unhygienic bodies. The design and shape of the bodies makes it difficult, if not impossible, to clean them. Maybe this could be relevant in your research sometime. So, not a question exactly.
But thank you, Thea. This is actually very interesting because this has been one of the main arguments as to why feeders actually could have contributed to infant mortality, because they are difficult to clean, right? They have this elongated nipple, and then some of them even have a sieve on top, which makes them very difficult to clean. But of course, this would be hard to prove other than just, using other examples from history, such as that. So I will definitely remember that. Thank you.
Anastasia Maravella asks, have you explored the concept of auri, prematurely dead, and especially what thought to represent for the living? Wouldn't then one expert that one would aid at distancing oneself from remains of prematurely dead rather than keeping them close? How does your research interact with this idea?
Thank you, Anastasia. I'm very unfamiliar with this, but it sounds, as I hear it now, I'm familiar with it, but it sounds very fascinating, and I will definitely have to include it in my thesis. So I will write it down later. I didn't quite catch the word, but thank you, Anastasia.
Let's ask a very last question. How many relevant studies for Sparta? I mean, I know you're focusing in Athens, but are your inquiries concerning infant death in Sparta, for example?
I haven't really had time.
No, if you know,
I
came
hope there
across.
is. I
Yeah.
really hope there is.
Mm.
And there should be, because, you know, Sparta is maybe most famously known for their brutal infanticide custom. There has to be some sort of
I'm
research on
just
this.
wondering, you know,
Yeah.
listening to you.
But that would be very interesting. Maybe for a PhD later. We'll see.
So let's drink to that,
Yeah.
and we can move to the room next door and continue the discussion. Thank you so much.